Knowing and treating thalassemia. Thalassemia is an inherited blood disorder that affects our body's ability to produce hemoglobin and red blood cells. Red blood cells is critical as it transports oxygen throughout the body. Hemoglobin is the protein in red blood cells that actually carries the oxygen. If you find the video useful, please click the like button and share it with others. Subscribe for more future content. Individuals with thalassemia produce less healthy hemoglobin proteins, and their bone marrow produces less healthy red blood cells. Thalassemias can cause slight or severe anemia and other difficulties that can occur over time, and conditions such as iron overload. Symptoms of anemia include dizziness, difficulty breathing, fatigue, and a pale skin tone. This condition can happen to anyone regardless of race and ethnicities, as they are an inherited disorder. There are two major types of thalassemia: alpha and beta thalassemia. For alpha thalassemia, individuals will be missing one alpha gene silent carrier and typically don't have any symptoms. Hemoglobin disease frequently causes symptoms at birth and can cause moderate to severe lifelong anemia. For beta thalassemia, individually have two beta-globin genes, one from each parent. Beta thalassemia is a change in one or both of the beta-globin genes. Therefore, beta thalassemia is the more severe condition out of the two. The symptoms: growth problems and bone disease such as osteoporosis. One with this condition can also have too much iron in their bodies, and this is as a result of frequent blood transfusion or the disease itself. Too much iron will cause damage to the heart, liver, and endocrine system. Moderate and severe thalassemias are often identified in childhood because symptoms typically persist during the first 2 years of a child's life. Therefore, how is thalassemia treated and how do we manage it? 1. Nutritional supplements. Folic acid supplements and the monitoring of B12 levels are important, as these are the essential components to form healthy blood cells. 2. Iron chelation. This involves the removal of excess iron from your body. This is important as regular blood transfusions will cause an iron overload which is hazardous. 3. Blood transfusion. Red blood cells will be injected via the vein to restore normal counts of red blood cells and hemoglobin. This is done and repeated every 4 months for severe thalassemia and every 3 to 4 weeks for those with beta thalassemia major. 4. Bone marrow transplant. A compatible donor will be needed for this treatment. This will also be the most effective treatment. A compatible donor with the same type of proteins known as human leukocyte antigens on their cells will be the best. Therefore, doing this from a sibling provided the identical genetics would be ideal for a complete recovery. However, even getting a sibling with identical donor is difficult. Nonetheless, if there is a suitable perfect donor, a patient can have their bone marrow make healthy red blood cells within a month itself. Knowing the high risks of a bone marrow transplant, it is not normally suggested for those with mild or moderate thalassemia. The best way to ensure all is fine is to have frequent complete blood counts and blood iron tests. This will be necessary for those living with this condition. Heart function and liver function tests will be useful and should be done annually. This is essential to identify any viral infection or iron overload in any cases. Stay strong, and there is always a way to things. Feel free to comment and we can all learn together on how we can cope on this. Thank you for watching.